Welcome to the HCA Healthcare Sarah Cannon Cancer Network Transplant and Cellular Therapy Network Discharge video. Congratulations on your recent transplant. As you prepare for your hospital discharge or what happens next, we want to help you feel prepared and answer any of your questions. Please write down any of those questions as you watch this video so they can be discussed with your healthcare team. HCA Healthcare Sarah Cannon Cancer Network is a collective of caregivers across the United States and United Kingdom, working together in relentless pursuit of transforming cancer care through cutting-edge research, specialized treatments, multidisciplinary collaboration, and care that is tailored to you. Oftentimes, the anticipation of discharging from the hospital is filled with both excitement and uncertainty. Our care team is committed to ensuring you are set up for success upon discharge. There are several factors taken into consideration when determining the appropriate and safe timing of your discharge. These factors include the recovery of neutrophil count, which are infection-fighting cells, that you've had no fever for 24 hours and you're able to eat both food and liquids. You'll also need to be able to take your medication by mouth. We will also make sure the patient and caregiver both understand the purpose, side effects, and administration times for all medications and are able to verbalize this information back to our team. Additionally, you may need to be able to perform daily central line care and personal hygiene with or without caregiver assistance, and you'll need discharge education completed by our nursing staff, pharmacists, and registered dietitians. You'll have your home care needs assessed, such as a walker or shower chair. You'll also need reliable transportation ready to take you to and from your physician appointments. Engraftment is an important milestone in the process of your post-transplant journey. After transplant, the healthy, blood-forming cells you received on transplant day move through your bloodstream and begin to settle into your bone marrow. Engraftment is when the cells begin to grow and create three kinds of new, healthy cells: white blood cells, red blood cells, and platelets. White blood cells fight infections. One important type of white blood cell is the neutrophil. These cells are made in bone marrow and travel in the blood. They sense, move toward, and fight infections. Red blood cells contain hemoglobin, which helps to carry oxygen from your lungs to all parts of your body. Platelets help your body form clots to stop bleeding. If one of your blood vessels gets damaged, it sends out signals that are picked up by the platelets. The platelets then rush to the site of damage and form a clot to repair the damage. Until your new cells engraft, your body can't fight off infections. Your transplant team will share guidelines on how to lower your chance of infection. After transplant day, and while you're waiting for your cells to engraft, you'll have your blood drawn every day so it can be tested in a lab. The test will count how many white blood cells, red blood cells, and platelets you have. Each day your transplant team will give you your numbers so you can see the progress. Engraftment can happen at a different time for each person. Often it happens within a couple of weeks to about a month after transplant day. White blood cells are the first of the cells to engraft, followed by the red blood cells and platelets. You may need red blood cell and platelet transfusions to keep your numbers in a safe range while you wait for engraftment. It's important to keep in mind that every patient's situation is unique. Your personal experience with engraftment will depend on specific factors, including the type of transplant, the source of your new cells, your overall health, the status of your disease, and how your body reacts and responds to the transplant. During your recovery, your transplant team will care for you, treat any side effects, and monitor you carefully for complications and infections. A caregiver plays an important role in a transplant patient's healthcare and recovery. In fact, most transplant centers require patients to have a caregiver to help care for them throughout the transplant process. As a caregiver, you will be called on to gather information, talk to doctors, participate in your loved one's care, and provide support. It can be overwhelming to be in a new world of medical terms, test results, and treatment choices. Each transplant patient's needs are different, so talking with your loved one ahead of time will give you a better understanding of their expectations. Caregivers will be responsible for a lot of the day-to-day medical, practical, and emotional support needed during the transplant. We encourage you to be an advocate. Let's go over the medical support responsibilities you'll have as a caregiver. Caregivers are responsible for communicating with the healthcare team and administering medications as scheduled. You'll also be monitoring and recording oral temperatures of the patient twice a day or when they're feeling unwell. You'll need to encourage the patient to do some walking and sitting up in their chair, monitor and remind them of their liquid intake, and remind them to do their mouth care. Caregivers are responsible for noticing any changes in the patient's condition and calling for medical help in an emergency. As a caregiver, you'll also be responsible for practical support needs. You'll be escorting the patient to and from clinic visits and assisting with financial and insurance issues. It's a good idea to check with a social worker about the possibility of grant funding options. At home, you'll be helping prepare meals according to a low microbial diet, maintaining a clean home environment, and reminding the patient to shower daily. Socially, you'll be keeping any family members and friends up to date on how the patient is doing, managing the number of visitors, and preventing contact with ill family or friends, and having masks for the patient when appropriate. You'll also be providing emotional support for the patient as a caregiver. Paying attention to their moods and feelings, communicating and listening to them, understanding any needs, and helping to make decisions are all ways you'll support the patient's emotional health. Being a caregiver is a full-time, 24-hour, 7 days a week responsibility. It is tiring, demanding, and stressful, especially if the patient's condition, schedule, or treatment changes. You may not be able to work and will need to stay with your loved one for most of the day and night. The caregiver must escort the patient to and from the outpatient cancer care clinic. While at the outpatient clinic, you can take some personal time, and this is something we strongly recommend. It is important for you to maintain a positive attitude, calm demeanor, and flexible approach while also providing support. Your medical team cares greatly about how you are doing overall, which is a concept we call wellness. Wellness includes how you, whether you're the patient or the caregiver, are doing physically, cognitively, emotionally, socially, and if relevant, spiritually. We encourage you to reach out to someone on your care team at any point moving forward if you feel you're struggling in one of these areas and would like to know what options are available for professional support and caregiver resources. Caregivers are so busy and often their own physical activity and wellness starts to plummet. Caregivers can benefit from setting smart goals around physical activity, and we strongly recommend building this into a caregiver's day. Sometimes patients and caregivers can together figure out healthy and achievable physical activity goals. For example, one couple identified the perfect bench in the park for the caregiver and patient to walk together. And then the patient waited on the bench while the caregiver did an additional loop, picked up the patient on the way back, and then walked home together. Upon returning home, we want you to be able to slowly resume your daily living activities. Let's take this time to go over some guidelines to daily living, including gardening and yard work, pets and plants, driving, traveling, swimming, the importance of sunscreen, and more. Depending on what medications you are currently on, alcohol may be permitted. Alcohol can damage the liver and, sometimes, your recovery from the transplant. Please check with your medical team on your potential alcohol restrictions. While you may be ready to put your green thumb to work, at this time you are to do no mowing, digging in the dirt, and/or gardening. If you have touched soil, wash your hands thoroughly with soap and water. Your immune system is still trying to kick in, and soils contain a lot of bacteria that you may not be able to fight off. While we're at it, no woodworking until at least 1 year out from your transplant and a platelet count of over 100. You could suffer a bad accident and also breathe in particles that your body isn't equipped to fight off yet. We all love our pets and houseplants, but it's imperative at this time to not clean litter boxes or be in contact with your pet's stool or urine. Avoid birds, reptiles, or amphibians, and do not clean aquariums. Be sure your pet's immunizations and health checks are up to date, and do not get any new pets during this important recovery time. Have your vet check your pet for toxoplasmosis every year. If you have a dog or cat, keep them indoors or at least on your property to prevent them from getting any diseases from other animals. Birds, lizards, snakes, turtles, hamster, or other rodents should be kept well away until at least 100 days post-transplant. When it comes to driving, be patient. You're out of the hospital, but you still need to come to clinic visits regularly. Until you reach 100 days, you'll be relying on your caregiver and support system to get you to visits. Once you're physically strong, mentally alert, and no longer on sedating medications, your doctor may clear you for solo driving. But be prepared for this to take approximately 100 days post-transplant. Typically, for the first 100 days post-transplant, we ask that you stay within 1 hour from your treatment location. We also ask that you follow masking protocols and stay away from crowds as much as possible. If you do plan to travel by plane, please discuss this with the transplant team. It's imperative that your platelets be high enough to travel safely. There also may be vaccinations that need to be given prior. Post-transplant, it takes time to regain strength, but it is important to stay active. Avoid contact sports, vigorous exercise, and activities that could result in injury or bleed. For example, we recommend your platelets be above 50,000 even for a gentle workout, and above 100,000 for more high impact. You'll need to be cleared by your medical team before restarting workouts, and if you plan to go to the gym, try and go during off hours. Sanitize machines prior to and after use, wear a mask, wash hands thoroughly, and shower after. When it comes to swimming, you'll want to aim for uncrowded, chlorinated pools and rest often. Remember, you will tire easily. Try to time your visits in the early or late hour to miss the crowds. Follow masking procedures and listen to your body. Stay away from freshwater pools and hot tubs unless otherwise specified by your doctor. If you still have a PICC line in place, please don't swim. Limit your time in direct sunlight. Your skin will be more sensitive and you may find you burn more easily due to the chemotherapy regimen and the medication you have taken or are currently taking. If you are out in the sunlight, we recommend you spend no longer than 30 minutes out each time. Protect with sunblock that has an SPF of 30 or higher every time, and wear appropriate covering like wide brim hats, long sleeves, and light-colored clothing and sunglasses. Do not go fishing if you have an indwelling intravenous catheter or central line. You'll also need to wait 100 days after your transplant before baiting, hooking, touching, or cleaning any fish. And no offshore fishing until at least 1 year post-transplant. If you plan on hunting, check with your medical team about your platelet count if using high-impact rifles, and do not clean meat until 1 year post-transplant. Laundry is a task that your caregiver and support system will need to handle for you. Do not handle dirty laundry until 100 days post-transplant. While it is okay to fold clean laundry, be sure to avoid all harsh soaps and detergents. A clean living environment is important after your transplant, but cleaning, like laundry, is something your caregiver and support system will need to do for you. Light housework is acceptable for you to handle after 100 days post-transplant, and you do not need to be the one deep cleaning until 6 months post-transplant. A supporter will need to vacuum, dust, and/or mop your home every week. And as the patient, you should not be in the room during the cleaning process and for an additional 30 minutes afterwards. Use products that are labeled antibacterial, and cleaning kitchen counters before and after food preparation is highly recommended. Allogeneic transplant patients need to be sure bed linens, including comforters and pillows, are laundered twice a week, and that all pillows and comforters do not contain any down feathers. We'll now go over health guidelines for intimacy and sexual activity. These topics can be very personal, but please ask your transplant team any questions at all so you're fully prepared to stay healthy. Hugging and kissing is encouraged if your partner has no sick or cold symptoms. Sharing a bed is also acceptable as long as partner, again, has no cold or infection symptoms. Please check with your transplant team if you are on maintenance therapy or anti-cancer therapy. During sexual activity, using lubricant is advised. Use caution if your platelets are less than 50,000. Alternative forms of sexual interactions should be discussed with your transplant team. Be sure to use effective methods of birth control to avoid pregnancies until cleared by your transplant team. Use condoms until 100 days post-transplant, or if your partner has a history of sexually transmitted disease, and no oral or anal sex until 100 days post-transplant. Again, your transplant team is here for you to help answer any questions you may have. Let's take a moment to talk through some very important concepts to think about when it comes to wellness within the context of cancer. First, wellness is relative. If you go down the path of comparing how you are doing, for example, how far you're walking, how your mood is, how many friends you're connecting with, or what you can do with them, to how things were before, you're at significant risk for becoming discouraged and losing momentum to keep making progress. While we encourage you to take active steps towards your wellness goals, we recognize the tremendous strain and stress you and your body have been under and remain under. Small and steady progress makes far more sustainable and stronger improvements in the long run than pushing too far, too fast. As undoubtedly you've discussed with your medical team, physical activity is very important for not just your physical wellness, but for your emotional wellness as well. Sometimes how much or what type of physical activity a patient does during recovery from transplant can become a source of tension between the patient and caregiver, as they may have very different expectations and perspectives about what is possible or reasonable. We recommend having a conversation with your medical team about what SMART goals for a physical activity are. Writing these down, trying hard to work toward them, and then discussing barriers or challenges at your next appointment versus letting this become a source of tension or conflict at home. Caregivers, if you have the benefit of having other social supports who can come by to spend time with your loved one while you get out to run errands or engage in self-care, take them up on it. Caregivers who take care of themselves are the best caregivers and are much less prone to burnout. Often, caregivers battle guilt, feeling like they shouldn't do things they enjoy while their loved ones can't. But in reality, self-care and maintained social connection for caregivers leads to the best emotional and physical outcomes for patients. As you prepare for the next phase of this journey, whether you are the patient or the caregiver, we wish you maximum wellness. Please reach out to anyone on your care team if you could feel that you could use additional support with any of the areas that we just talked about. We encourage you to take care of your body, your mind, your emotions, and your spirit with the utmost care. And also know that progress with wellness is not always a straight line. It can feel like a few steps forward and many steps back. This is normal. Have patience with yourself. Have patience with your loved ones. Have patience with your body and your relationships. And hopefully with time, you will notice yourself better able to engage in the activities that bring you joy and that align with your values. We wish you well, and we encourage you to reach out as needed throughout the next phase of your journey. One of the most important components of your ongoing recovery is preventing infections. Once you have engrafted, your body will begin to be able to defend itself from infections. However, it can take between 3 and 12 months for your immune system to recover. We'll walk through some very important guidelines to help prevent infections and allow your immune system time to gain strength for a better long-term transplant recovery. Masking and staying precautious about any type of social situation are both very important to protect you from infections. Avoid all contact with people who are sick or symptomatic, even if it seems minor or just like it's allergies. Wear a mask anytime you're in a public space or around a group of people, or anytime new people come into your home or environment. Anyone who enters your home or environment should wear a mask. When it comes to types of masks, an N95 or KN95 mask will provide a better level of protection and can be obtained from most drugstores, supermarkets, or online. A simple mask, surgical mask, or cloth mask will also offer some protection from droplets and other infection-causing microbes. Avoid crowds as much as possible, because more people equals more germs. And try to maintain a 6-foot distance from people in public. Avoid close contact, which is within 6 feet, with anyone who has received a live vaccine for 14 days from their vaccination date. Live vaccines include the intranasal flu, which is an inhaled vaccine, MMR, shingles, rotavirus, and chickenpox vaccines. One of the best methods for preventing infections is frequent, thorough hand washing. Using soap and water is ideal, but alcohol-based hand sanitizers will also provide adequate hygiene. Wash your hands before eating, before touching your face, and before touching your line or IV. Wash your hands before and after using the bathroom, after being in a public space, after touching any animals, and before you take any medications. Caregivers and anyone else who enters your home or environment needs to also wash their hands thoroughly and frequently. Frequent hand washing can cause dryness, leading to breaks in skin or cracked cuticles, so use lotion regularly to keep skin intact and reduce the risk of germs getting into your body through a break in your skin. Personal hygiene is another important component of infection prevention. Upon discharge from the hospital, you should use new or clean bathroom supplies, such as your toothbrush, washcloth, loofah, makeup, and makeup brushes. Make sure that all bathroom supplies are for your use only and are not shared with anyone else. Be sure to use a new soft bristle toothbrush. It's important to shower daily using a gentle soap of your choice. Avoid drying soaps like ivory or deodorant soap, as they will dry out your skin. If you were using a CHG soap or other hospital-provided soap during your transplant, it is not required that you continue to use that soap unless directed to do so by your physician. For complete hygiene, avoid use of tampons, douches, rectal suppositories, or enemas during your recovery time. Clean your line site following every shower. If your line still has a dressing, protect the dressing with an AquaGuard shower cover Tegaderm XL or per the facility recommendation to keep moisture from getting under the dressing. Moisture under the dressing can harbor bacteria and reduce the effectiveness of antimicrobial components of the dressing. When taking a bath, be sure and do not submerge your line underwater. Make sure to continue good oral care like toothbrushing and oral rinses, such as bicarb rinses, especially after meals and before bed. For dry mouth, use biotin products as needed and avoid mouth rinses that contain alcohol. Avoid flossing until your physician tells you that your platelet count has recovered enough that you may resume flossing. Manicures and pedicures have a few guidelines as well. Do not go to a public place for manicures or pedicures. If a manicure or pedicure is done at your home, it is recommended that you wait at least 3 months after transplant. Be cautious when trimming or clipping nails, as low platelets could lead to bleeding and potential infection. Best practice is to leave nails slightly longer when trimming to avoid cutting yourself with clippers. Another guideline to protect you from infections is to refrain from any new tattoos or piercings for at least 1 year after your transplant. If using contact lenses, always wash your hands prior to placing contacts or touching your eyes to prevent infection. Upon returning home, you can resume use of contact lenses as directed by your provider. If using disposable lenses, start with a new pair. Make sure that reusable contacts are cleaned well before use. Contact use can lead to eye dryness, so use saline or moisturizing drops to offset any dryness you may experience. When possible, a designated bathroom should be limited to patient use only, and caregivers and other family should use a different bathroom. Your bathroom should be cleaned daily, including wiping down any handles, fixtures, toilet seats, and other high-touch areas. Additional, more thorough bathroom cleaning should happen weekly, such as cleaning the toilet bowl, shower, and floors. It's important to use a fresh towel and washcloth for every shower. Allogeneic transplant patients need to follow these additional guidelines to best prevent infections during ongoing recovery. Do not change children's diapers or adult diapers until you are specifically cleared to do so by the transplant team. If your house or apartment has a swamp cooler, the synthetic drip pads should be replaced before you return home. Also, the cooler should be run daily for at least 30 minutes to avoid water sitting in the reservoir. Gas-burning fireplaces are fine, but do not use wood-burning fireplaces or wood stoves. Someone should change the filter on your home air conditioner and furnace before you arrive home. It's also recommended to go ahead and get a professional inspection and cleaning of your air conditioner system. Continue having a supporter regularly replace the filter during the first year, following manufacturer instructions. Air conditioners in the vehicle you'll be in should also be serviced and cleaned before you are discharged. If you have fans, someone else should remove and clean the dust from fan blades and motors regularly, about 3 times per week when in use. Nutritional health is important to support your immune system, prevent weight loss, and promote healing and wellness after chemotherapy and transplant. Use these guidelines to keep yourself healthy and nourished while preventing foodborne illness. You can follow a regular diet, since a neutropenic diet that avoids fruits and vegetables is not necessary. Focus on including whole grains, fruits, vegetables, meats, or meat alternatives, cheese and dairy or dairy alternatives every day. Concentrate on high-protein foods like lean meats, fish, poultry, eggs, low-fat dairy products, and beans to promote cellular growth and enhance your immune system. It's recommended to eat 2 cups of fruit and 2.5 cups of vegetables every day. Eat small, frequent meals, avoiding fried, spicy, acidic, or salty foods, all of which can contribute to nausea. Do your best to avoid skipping any meals or snacks. Be aware that any taste changes and nausea may persist for months after your transplant. Doing an oral rinse before meals can help make foods taste better, and make sure to brush your teeth and do an oral rinse after every meal. If you're experiencing nausea that is limiting your dietary intake, take an antiemetic or nausea medicine 30 minutes prior to a meal. Let's review guidelines for food safety and preparation. Caregivers should do all the food prep and after-meal cleanup. Caregivers need to wash hands with soap in warm water before and after food prep and after handling raw meat. Patients need to wash hands before and after eating. Wash fresh or raw fruit and vegetables in running tap water for at least 15 seconds. Do not use soap, detergents, or produce sprays, but a small brush can be helpful in removing surface dirt. Even thick-skinned produce like bananas, oranges, and potatoes should also be washed. Wash cutting boards, dishes, utensils, and countertops before and after use. Separate raw meat, poultry, and seafood from other foods by placing them in a plastic bag when buying groceries or storing in a refrigerator. Use a different cutting board for raw meat, poultry, and seafood to avoid contamination, and do not place cooked food on a plate that held raw foods. Cook all foods fully and don't consume rare or medium rare meats. Use a thermometer to ensure foods are fully cooked. Do not defrost food at room temperature. Place frozen foods in the refrigerator to defrost, or use a microwave and cooked thaw foods immediately after thawing. Leftovers should be thrown out after 3 days, which is 72 hours. Do not save food at room temperature and return to it later. You'll need to dispose of half-eaten meals. Keep the refrigerator clean and clean spills immediately. Do not use water from a community well, but city tap water is safe to use. Now, for some guidelines to keep you safe when restaurant dining. Avoid crowds until approved by your physician. Check the general condition of a restaurant to assess the care taken in their food preparation. Avoid dirty restaurants and less than trustworthy food preparation. Salad bars, buffets, potlucks, store samples, and sidewalk vendors or food trucks are risky dining options. Any self-service dining option like buffets should be avoided due to the number of people who contact foods. Avoid foods made by neighbors or friends unless you are confident in their food safety and preparation. Let's go over guidelines for dietary supplementation. Take a multivitamin and mineral supplement for the year following your transplant. Multivitamins cannot contain iron, herbs, or other plants, or more than 200% of the recommended dietary allowance of vitamin and mineral needs. Speak to a dietitian about which multivitamin is best for you. Calcium is essential for bone health, especially for adult females and people taking prednisone or steroids. Calcium-rich foods include dairy products, beans, and nutritional supplements. Magnesium and potassium are often very low during and after a transplant. Magnesium-rich foods include nuts, bran cereals, brown rice, and whole grain breads. Potassium-rich foods include fruits like bananas, vegetables such as avocados, and dairy products. Nutritional supplements like Kate Farms or Gain, Ensure, or Boost are good sources of protein, vitamins, and minerals, especially if meals are challenging. You can use these in addition to dietary intake daily or as a meal replacement occasionally. Probiotics should be avoided because they could overwhelm a compromised immune system. Rebuild gut health with yogurts, cheeses, and green leafy vegetables. You have already been following an immune-compromised diet during your chemotherapy treatment prior to transplant, so there will not be many changes from the guidelines you are currently following. These guidelines are to help protect you from any food-related disease or complications such as food poisoning. Keep perishable food items safe to consume by following these guidelines. Store meats and dairy and frozen foods at a safe temperature. When grocery shopping, never select items with damaged packaging, such as leaks or tears. Place raw meats and poultry into a plastic bag to keep meat juices from dripping on other foods. Put refrigerated or frozen items in your cart last, and then put these items away first when you get home. When selecting non-perishable food items, be sure and check the expiration dates and do not buy or use anything that is out of date. Don't purchase damaged items such as dented cans, cracked glass jars, or products with torn packaging or damaged tamper-resistant seals. It's a good habit to be aware of use-by dates on items before using them at home. Now, let's go over guidelines around deli foods. Deli-style meats are not allowed because the machine used for slicing meat is not often cleaned adequately to protect you from possible contamination. Sandwiches from fast food places or delicatessens are not permitted. Don't purchase ready-to-eat items that share space with raw food items to prevent cross-contamination. Make sure you observe the clerk washing their hands and putting on fresh gloves before they serve you. Keeping your food safe at home is another important focus to decrease your risk of contracting a foodborne infection. Check your refrigerator temperature, which should be 40 degrees or less. When thawing meat, place it into a bowl or container and make sure it does not drip onto other food items. Store ground meat, poultry, and fish for 1 to 2 days only. Red meat should be used within 3 to 5 days. If you have eggs, leave them in the store container and do not store them in the door of the refrigerator to help make sure they remain at a safe temperature. Store cooked food in the refrigerator no longer than 3 days, and if you want to keep it longer, place it in the freezer instead. Always clean any spills immediately when they happen to keep your refrigerator from becoming a breeding ground for bacteria. Now, let's talk about safe ways to store your food in the freezer. First, check the temperature of your freezer. It should be set and maintained at 0 degrees. The quality of food suffers with items that are frozen for long periods of time, such as freezer burn on meats and vegetables. It is okay to eat an item that passed its expiration date while frozen, but be sure to cook or use the item as soon as it has thawed. Once items have been thawed, bacteria can become active, so be sure to handle thawed items as you would any perishable item. Freezing keeps food safe by preventing the growth of bacteria that can cause foods to go bad or could cause foodborne illness. Store pantry items such as canned foods and other shelf-stable items in a cool, dry place. Never store food over the stove, under the sink, in a damp garage or basement, or any other place that will be exposed to extreme high or low temperatures. Improper food handling or preparation can be a cause of foodborne illness. So here are guidelines to best keep you safe. It is important that you follow good hand washing technique when handling food. In general, wash your hands before and after handling food, using the bathroom, taking medications, changing diapers, or handling pets. Wash all utensils, can openers, cutting boards, and countertops with hot, soapy water before and after coming in contact with raw meat, poultry, or fish. Use cutting boards made from plastic, marble, glass, or ceramic, as these are easier to clean and more sanitary than wood cutting boards. When possible, use one surface to clean or prep fruits and vegetables and a different surface for raw meats. This simple practice will help prevent cross-contamination of your food. If you do use a wood cutting board, it is recommended to sanitize it using 1 tablespoon of unscented liquid bleach in 1 gallon of hot water. It is not recommended to go into the dishwasher. When cooking at home, red meat such as ground beef and steaks should be cooked to well done, without any visible pinkness, which is a suggested internal temperature of 150 degrees or more. Seafood is permitted to eat if it has been cooked. No raw oysters or ceviche due to the risk of bacteria. Pork products such as pork chops, pork steaks, or roasts should also be cooked well done without any visible pinkness of the juices or meat. 160 degrees is the suggested internal temperature for pork. Chicken products including whole chickens, breasts, tenders, wings, and ground chicken should be cooked well done without any pinkness or pink-tinged juices. This is a suggested internal temperature of 165 degrees or more. Eggs are recommended to be cooked through or hard cooked. It's not permitted to consume any sunny side up, over easy, and soft-boiled eggs. Food left out on the counter can begin to grow bacteria within a few hours. Never leave perishable foods out on the refrigerator longer than 2 hours. Divide leftovers into shallow, airtight containers. You should always reheat leftovers thoroughly either in the microwave or stove, and never reheat leftovers more than once. Some good news is you can eat at restaurants and enjoy curbside pickup by following these guidelines. Avoid dining at restaurants during peak times. Keep in mind that using curbside pickup is typically safer than sitting down for a meal in a restaurant. Select a place with good reviews for cleanliness. Ask for your food to be prepared fresh or make a special order. Do not get lettuce, tomatoes, pickles, or onions on your burgers or sandwiches from these restaurants. Use your own washed vegetables from home instead. Use single-serve condiment packets and avoid buffets and salad bars. Soft-serve ice cream, yogurt, and milkshakes are not allowed from restaurants because the machines are not adequately cleaned and could harbor bacteria that could make you sick. Store-bought packaged ice cream and yogurt are allowed. Raw fruits and vegetables are okay at home once they have been washed using white vinegar and water mixtures that are a 1 to 3 parts ratio. Don't share food on your plate, utensils, or beverages with family or friends to help protect you. Try different foods, as your taste will still be a little off at discharge. If you are still experiencing nausea at discharge, avoid spicy items or foods that have a strong odor. Be sure and use your prescribed antiemetics or nausea medicine 30 minutes before you plan to eat if needed. Remember, you do not have to eat 3 large meals per day. You can get adequate calories by grazing all day, in addition to using approved nutritional supplements such as Boost or Ensure. Alcohol is discouraged until your physician gives you approval. Remember, your taste is still going to be off, and things may not taste the same for several months. Now, let's review appropriate guidelines and rules to follow when it comes to returning to your more social settings and activities. First, you must be cleared by your doctor and medical team before returning to work, school, or religious activities. Depending on your type of work and the doctor's advice, it could be 100 days or more after your transplant before you can return to work. If working from home is an option, that would be the ideal situation to start. But again, depending on the location and type of job, your doctor and medical team will decide if and when you can return to work. Let your healthcare team know if you need a letter or document about working virtually or from home. It may be a few months before a child or individual can return to school after a transplant. Your doctor and medical team will also decide when it is the appropriate time to return. Online school, homeschool, and tutoring are great options for the first few months after a transplant. Please notify your healthcare team if you need a letter for any of these options. Also, check with your healthcare provider to see when it is permissible for your child to return to a daycare facility. Much like work and school, you must be cleared by your medical team before returning in person to religious activities. In addition, you are at significant risk of acquiring infections in the months following a transplant. Hand washing is key after interacting and exposing yourself to a large group of people. Use hand sanitizer after shaking anyone's hands. Use soap and warm water and scrub for 20 seconds to wash your hands after a few applications of the hand sanitizer. Also, do not drink from the religious chalices until at least 100 days post-transplant. It is advisable to arrive as the service begins, sit in the back, and leave prior to the end of service to limit the number of people you come in contact with, or to use a quiet room if one is available. Don't hesitate to contact your healthcare provider and team for other questions regarding returning to work, school, or religious establishment. Next, let's talk through the side effects of a transplant and how long you can anticipate these side effects to last. Some of the most common side effects after transplant are fatigue, weakness, decreased appetite, hair loss, stomach upset such as nausea and diarrhea. However, as your blood counts and immune system recover after the transplant, some symptoms will begin to improve or resolve. It can take a couple of months for your body to recover from a transplant. When you are less dependent on blood and platelet transfusions after the transplant, your body will start to get some of its natural energy back. Physical and occupational therapy can be a great option if the weakness does not improve. If you notice changes in strength or stamina during routine daily activities, please inform your provider. Your provider will determine the need for a physical or occupational therapy referral to improve your safety and independence. During this time, be slow and careful when standing up from a sitting position, but continue to get out of bed and be active at home. Be ready for the possibility that any weakness and fatigue may delay your provider from releasing you to drive. Some patients experience a change in taste after transplant. Usually, after 2 to 3 months, your ability to taste will resolve, but sometimes it can persist longer. Diarrhea and nausea usually improve before discharge from the hospital. However, occasional stomach upset and nausea can continue for a few months. You will be discharged with medications to help you manage these symptoms at home. It can help to avoid spicy foods and dairy products during this time. If diarrhea and stomach upset persist or worsen, notify your healthcare team immediately because this could be a sign of an infection. It can take 2 to 3 months for your hair to grow after a transplant. Don't be surprised or alarmed if your hair grows back a different shade or texture than it was before. During this time, wear head coverings if you go out in the sun or cold weather. Your scalp can still be very sensitive in the months following a transplant. Now we'll discuss the importance of taking medications as scheduled and highlight medication categories, such as immunosuppression and anti-infectives. Taking medications exactly as prescribed before, during, and after transplant is incredibly important. It requires a lot of organization to ensure the medications are taken at the right time of day and as directed with regards to specific instructions. Your pharmacist will review medications with you before and after your transplant, and you will be provided with a guide to help you keep track of each medication. It's important to be aware of the purpose of each medication, as well as directions regarding appropriate times of day to take, potential interactions with food, drink, and other medications, and dates to start and stop each agent. Taking your medications incorrectly may lead to a lack of effectiveness or serious side effects. If you're ever confused or unsure about how to take your medication or what to do if you miss a dose, reach out to your clinic staff and the pharmacist or nurse will be there to answer your questions. Also, never start or stop a medication, even over-the-counter options or vitamins, without checking with your doctor first. You'll be on a number of medications at any given time to help manage the side effects of your transplant and the chemotherapy you received. They can generally be grouped into categories, which we'll review. Just keep in mind the names, shapes, sizes, doses, instructions of the medications you're taking can change at any time, so always ask for clarification if you're unsure of what you should be doing. You'll take various medications to help you manage various symptoms you may have after your transplant, and as a result of taking so many medications. Some of these medications manage any gastrointestinal symptoms you may have, including nausea, vomiting, constipation, and diarrhea. It's also common to require a pain medication after transplant to manage mouth pain or other discomfort. It's important to take pain medications only as prescribed. If you're too drowsy or the pain medication is not helping, please review with your provider before making any changes or taking something over the counter. You'll also be restarted on medications you may have been taking before your transplant to manage previous conditions or new conditions that developed, such as high blood pressure, high blood sugars, and cholesterol management. Your doses and medications may have changed over the course of the transplant or due to the new medications you'll be taking, so make sure you follow any guidance given. Finally, you may be started or restarted on a medication to control your cancer. This is usually referred to as maintenance, and it's to keep any potential cancer cells from coming back after your transplant. Your provider will instruct you on when to start or stop this medication. While this doesn't encompass everything you may be taking, we hope this review emphasizes how important it is for you and your caregiver to record medication details, stay organized, and take your medications as prescribed. Your provider and the team's primary role is to make sure you're as comfortable as possible during the journey. So make sure you report any physical or mental discomfort as well as any uncertainty around the medications you're taking. It can be overwhelming, but the team is ready to help clarify any questions or issues you may have. Allogeneic transplant patients have additional concerns during recovery due to the use of donor cells. A common, sometimes serious side effect is graft-versus-host-disease, often abbreviated as GVHD. An allogeneic transplant uses healthy, blood-forming cells, also called stem cells, donated by someone else. GVHD develops when new donated cells do not recognize a patient's body, and as a result, their body is attacked by the new cells. GVHD can range from mild to severe, or in some cases, it can be life-threatening. GVHD may be temporary, or it may be a disease that you continue to have long after transplant. If you develop GVHD, your doctors will provide treatment and help ease your symptoms. Some common symptoms of GVHD are skin rash, yellowing of the skin or eyes, and diarrhea. There are things you can do to lower your chances of developing GVHD. The first is to take your prescribed medicines and continue to take them even if you feel healthy. Secondly, be alert for any warning signs and tell your doctor about any changes in your body that you see or feel. Your transplant team will give you a list of signs and symptoms to watch out for. Sometimes primary care doctors or hematology oncology specialists may not know the symptoms of GVHD. It's important for all of your doctors and transplant team to talk to each other and share information about your health. If you're concerned about a new symptom at any point, ask your doctors to check in with each other. The third is to avoid exposure to the sun. The sun's UV rays may trigger GVHD or make it worse. If you go out, make sure you always wear a hat, sunglasses, long sleeves, and pants. Also, apply SPF 50 sunscreen to all exposed skin. You may also want to wear SPF clothing for added protection. Always remember that the sun on a cool day and cloudy day can be just as damaging as on a hot and sunny day. The treatment for GVHD works well for many patients. However, you may need to be treated for weeks or months. This is because it can take time to find the best medicines for you with the fewest side effects. This class of drugs is used to prevent the immune system from being too aggressive right after your transplant. This class of drugs is probably the most dynamic in that you'll be on different ones at different times, depending on your status post-transplant. Some of these drugs may be dosed based on the level they are in your body, so make sure to follow instructions on when to take them with regards to when your blood is drawn on clinic visits or lab checks. The length of time and how many immunosuppressants you're on will vary based on whether or not you develop graft-versus-host-disease or another complication. Since you're immunosuppressed, you'll be more susceptible to an infection, so you'll have to be on a number of medications to try to prevent infections from happening. You'll need a medication for each type of potential infection, including bacterial, fungal, viral, and atypical infections. The medications you're on will be determined by any infections you may have previously had and the level of suppression of your immune system. Again, you'll be on different anti-infectives at different times. Be aware that taking an anti-infective is not a guarantee you won't get an infection, but it's the best way to try and prevent one from happening. While GVHD is serious, there are treatment options and early detection is very important. Your healthcare team will be there for you anytime you need help. At discharge, you'll receive specific instructions on when and who to call 24/7 when symptoms arise. It's important to notify your healthcare team when you experience any of the following symptoms. Call if you have signs of infections, such as a fever greater than 100.4 degrees Fahrenheit, or a fever with chills. If you have any changes in your condition, such as a persistent headache, severe vision changes, or a change in your mental state, please notify your team. Let's talk about pain. If your pain is not being managed with the medications your provider has prescribed, or if you are having pain with the urination and/or with bowel movement, it's important that you call your team. If you experience new or persistent bleeding, such as nosebleeds, blood in your urine or stool, or unusual bruising, or if you experience a new or persistent cough, shortness of breath, difficulty swallowing, or swelling in your lips, tongue, or throat, let your team know so they can help. It's important that you notify your healthcare team if you're having difficulty taking medications or trouble keeping fluids or medications down. Let someone know if you're vomiting and/or having diarrhea that is not being controlled by your prescribed medications. If you notice changes in your central line, such as redness, warmth, bleeding, swelling, drainage, or streaking, which is a red outline of your central line, call us no matter the hour. Also, let someone know if you have a new or persistent rash or skin changes. Allogeneic transplant patients also need to notify the healthcare team as soon as possible if any new signs of symptoms of graft-versus-host-disease appear. GVHD can present itself in a wide variety of ways, and your team will provide you with a full list. But for now, let's go over a few of the most common to call your team about. Call someone if you develop a cough, are having trouble breathing, or if you have a fever. Let your team know if you're experiencing gastrointestinal issues like nausea, vomiting, or diarrhea. If you have any new skin problems, new mouth sores, or new taste changes, or eye issues such as irritation, dryness, or jaundice-like yellowing, it's important to give your team a call with as many details as you can. All transplant patients will receive an Oncology Alert Program card, which ensures you'll receive the fastest, safest help possible during an emergency room visit. You'll show your Fast Track card as soon as you arrive, which will identify your urgent care needs, get you placed in a private room, and activate protocols for safety, screening, assessment, and labs specific to immunocompromised patients. Our Sarah Cannon Transplant and Cellular Therapy Network goal is to get you any antibiotics you need in less than 60 minutes from when you walk through the door. One question on many patients' minds is, did my transplant work? It takes about 3 to 12 months for the body to recover from transplant, especially from effects like fatigue, and dependent on your stage of disease, your care team will be able to see if the transplant was effective over the next few months by clinical imaging, biopsy, and workups. Following your transplant, we will need to see you frequently in the outpatient clinic to support your recovery and manage side effects. Your transplant team will determine how often you need to come to the clinic. Please be sure to schedule your next visit prior to leaving the clinic, and be sure to know who to call if you do not feel well. Let's go over a few reminders about clinic visits following a blood and marrow transplant. Until you are cleared by your medical provider, do not drive yourself to the clinic visits. Please have your caregiver drive you to and from the clinic each visit. Before each clinic appointment, you may be waiting in a common area with other patients. For your protection, please bring a mask to wear and wash your hands often throughout your visit. If you are not feeling well or have a fever or cough, please let us know ahead of time by calling us or telling us immediately when you check in for your appointment. For those first appointments after transplant, plan to stay for up to a few hours each visit to allow time for a nurse and/or provider visit, lab draws, and any intravenous infusions such as fluids or blood products you may need. The following items are what you should bring to each clinic visit. Bring your medicines with you. We will want to review your medicines and order any refills needed during your visit. Also bring any paperwork related to your medical care you need us to complete, for example, disability or FMLA forms. To help keep you comfortable during your visit, bring anything you need, such as a small blanket, a favorite snack, or a book to read. Once you have recovered from your transplant and no longer need close monitoring and frequent treatments, the medical team will help transition your care back to your primary care provider and oncologist. Your medical team will send medical records to help update your home physicians about your transplant course and a plan for your care after transplant. We will also send our contact information so your home physicians can call us with any questions they may have. We will schedule you to come back and see us around 3, 6, and 12 months after your transplant, also called long-term follow-up or survivorship care. During these appointments, we will check for any changes in your health, including any signs of your cancer coming back, monitor any unique side effects associated with your transplant, and evaluate any changes in your quality of life. When these issues are caught early, they may be more treatable. These milestone visits help us ensure that you get the best possible health care following transplant, and we encourage you to make them a priority throughout your recovery. Most patients will begin re-immunizations with routine vaccines within the first year following transplant. You probably had many of these vaccines when you were a child, but they may no longer protect you after chemotherapy and transplant. We will let you know when you are ready to begin the vaccinations. Until that time, please do not schedule any vaccinations without checking in with your medical team. Keep in mind that it may take a year or longer to heal, so it's important to give yourself time to get back to your pre-transplant routine. Through survivorship care, we will remain here for you as part of your after-transplant recovery team. Be assured that your transplant team will be there to guide and support you every step of the way. The information in this video is intended to help reinforce the many guidelines shared by your transplant team and should not replace a healthcare professional's medical judgment regarding your situation. Congratulations on your transplant, and thank you for putting your trust in us. Please reach out to your team with any questions you may have. They're here to help. Thank you for watching this video.